Okay. The crown seems to be a boring topic. It's a big circle on the back of the head, but I'm going to change your idea. I'm going to show you why this is actually artistic, fun, and amazing. So how do you explain to something to a patient that may not be that important to them because in the back of the scalp? Well, to me, the front is the most important. But, what's going on? Someone, they have a mic on? Oh, someone's mic on? No. All right, but you present all sides of the picture. So what does that mean? It's not just the back side that is the issue. It causes a flattening from the side view that's very evident, and the way it can cause some thinness even from the frontal view if it's extensive. And I'm going to show you how to improve all three areas, front, sides, and back. Not just the back, which is the obvious improvement. So who's a candidate? So for me, age is one of the first criteria that I love. Now, I just did a 30-year-old crown, but that's pretty rare that I do that. There's a lot of reasons. I've been following him for about 7 to 8 years. He's been absolutely stable. He was off finasteride, and he still was stable. So I felt, okay, I went way beyond his crown zone. Still there's risk. He's got good donor capacity for future problems. So I'm a little bit more conservative on that scale, but in generally, I like to know a few things. So I want to know, is the front been done? If the front is all weak and you stick this big crown on the back, it's not going to look great. The priority is the front. Plus, in the front, I know comb over looks bad, which you're combing hair in the temporal zone over to the mid-scalp, but they can comb it back. I had a guy from the Northwest that came in from Seattle, and he, many years ago, he had plugs, I fixed him. He came in for a second session, and I was like, why is he here? He had combed his hair over this massive crown, and he looked like he had full head of hair. But then, of course, it is crown. So it's just like one of those things that you wonder, but you think if you can comb that hair back over, it really looks good. I call it a comb back. It actually can give someone a full head of hair. So think about that. And then, is it stabilized? Are you just thinking, oh, he's a good candidate, let's do surgery? I really want to make sure that crown is not progressive, because that, as you heard from Steve, is a big debt burden that you may not be able to face. And that leaves my last point, which is donor to baldness. I mean, what do you have in that donor? You got high capacity, a relatively high fringe, you've got a narrow bald zone, is great, but you got a massive bald area, a very young patient, extensive miniaturization, a coronet extending down, which we'll explain in a moment. You've got issues. So your judgment is so critical. And I'm not talking about present issues. I always talk to the patient about what I predict in 10 to 20 years. And I always say predict without certainty, because I don't know. But if I don't talk about future issues on the consult, that's the difference between a salesperson and a physician. Okay, and I always like to say I'm not dealing with clients, I'm dealing with patients, because that's so important to think that and really understand they need more procedures in the future. Okay, unless they're white hair, 70 years old, I'm really going into the concept of future issues and how to avoid it, and what if there's a step off, what can they do to make that not visible. So Ziering has looked at this, and its majority are this clockwise whirl, just whirls, and in women the majority is diffusion. That's the take home of this, but really nothing beyond that, except these are just a sort of an epidemiological study. And then understand there's different types of crown patterns. The only one I want you to remember is this coronet. Look for it. Look for miniaturization in that central lower portion, because that's gonna freak you out when you wet the hair down and go, wow, I thought I needed 1,500 grafts. Now I've got this extension going down into the donor hair, and I harvested it into it. So look for that coronet pattern. This is, I think Mike Beaner came up with this. I don't want to give credit to the wrong person, but the billboard effect, I say this to my patients. I love talking about limitations. I don't just love talking about the awesome stuff of it. I talk about limitations and risk. Billboard effect is huge. What is a billboard effect? It's the idea that the crown is on the vertical posterior scalp. A lot of my patients think the crown is here. They say crown is this. So I have to clarify with them. But they say crown, ask them, what do you mean by crown? And it's weird. I've had several patients even the last 2 weeks said, you mean here, doc? I go, no, the vertical plane back here. Oh, so it's on a vertical plane, and so you're looking straight on it. So what is definition of baldness? It's not just the absence of hair, it's a visualization of the scalp. And so what's on a vertical plane, you can see that baldness much more easily than on a tangential plane. Plus, they all whirl open and spray open like this. So you have to fight both of those. And I'm going to talk to you about some strategies how to fight that, because you need to fight the limitations of the anatomy here, which is that billboard. Plus, you have this, you have pi r squared. You heard this already. Pi r squared. If you don't like math, just know this formula. That's all you need to know here, because when that radius doubles, you got quadruple the surface area debt burden you've got to fill, okay? That's a huge debt burden. So what do you do with planning the donor? Well, as I said, look for that coronet. And for me, when I've got someone with extensive baldness, I don't go to FUE. I think if they don't have a high fringe and it's a very narrow zone, I really am scared to do FUE, because I think I'm really tapping into that donor hair, over tapping in for an area that I rather not tap into. So if I've got extensive baldness, Norwood 6'7", I don't even think of it. It doesn't even cross my mind. It's like game over for me, okay? That's where I don't even think about that. Initial plan, circle it out. When you wet the hair, you may think, oh my God, it's a little bit worse. Older patients, you can be a little more conservative on. Younger patients, you got to worry about future loss. Heard that from Carlos yesterday during the consult. You got to think about future progression of this so that they don't come back in 3 years and go, what happened here? Females, you already heard this just a few minutes ago. They're just sometimes a little that central zone where they can get a little more lift. They talk about lack of lift back. They don't talk about a big crown oftentimes. That can help. So how do we break it down? So we have to talk about anatomy and understand the lingo here. So the central whorl is there. There's the upper arc that's above the whorl, the lower arc below the whorl. I'm using some of these terminologies. The vertex transition point or vertex transition zone is that transition, as I mentioned, the head like a box from a vertical scalp to a horizontal scalp. And that's the anterior limit of the crown. Of course, if you go farther back, I call that posterior mid-scalp. So remember that there are no abrupt transitions. So what does that mean? So let's look at this. If we draw first a central whorl and you think about how this area is going to join, look at even that changeover. There is no boom, boom, boom. There is just soft transitions. Nature or God and nature have created this not to be abrupt. If you're making sharp, abrupt angle changes, that is a problem. So let's talk about design. This is the cool part. So how do I prefer to design it? If they're totally bald, they have no extensive miniaturization, I don't have to worry about it, I have a blank slate to work, and they part from left to right, this is what I do. I oftentimes do a high whorl to the left. Why? If I can pick and choose how I'm going to paint my canvas, this is how I'm going to do it. Because it gives me 3 advantages. 1, that hair part is the most exposed area. If I can have that hairs go up over the hair part, it's awesome. The second great thing is it follows the comb direction. So it gives me visual density, easier combability without them combing and separating that part on the back side. The third thing is because on the top end of that crown, it allows me vertically using gravity to fall down over the crown and cover it versus my having to arch up and try to work on this to come back down, if that makes sense. So this is how I like to design it. And then also when you're looking at hairs, you think about this graph sizes, you think about the density patterns, you think about, where I'm going to create more density. The biggest mistake though is to hear this lecture and go, oh, Sam said put a huge density here and just leave blank slates. No, you have to blend it all the way out. You don't want to create this crappy lower fringe and this incredibly high density. But this is that density gradient. And as I told you, when you start out, don't make density gradients. Just make it relatively even. You're going to create some serious problems by over-dense. Oh my God, he told me I want to go dense, 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 dense. No, you don't. Okay? Dense, dense. You'll be dense if you do that. Okay? So don't do it. And so other examples here. What if the hair pattern went the other way? Well, follow it. If they've got a lot of hair, don't say that, if they don't have a blank slate, you've got to follow it. And then you want to create density patterns. Think about it. The cascade effect, you heard about that, I introduced it yesterday, which is how a hair falls from here all the way over there and travels. You can leverage some of that. But this is an advanced topic. Why am I presenting this? Because you need to hear everything, and then you've got to stay with the basics. And then this is just a left. What if it starts at the bottom left? Well, then this is how I create density. Think about that. Number 1, comes up and over. Number 3 only covers a little bit. You still need number 3 to be covered and 4 to be covered, but they're not quite as high a priority in terms of how you design it, in terms of donor density, use of graphs, etc. And this is just the same thing, just with it's a counterclockwise world, no big deal. So just teaching you to think about that. Graph sizes, you're looking at different sizes. from, I put slightly, if there are 4 hair grafts, I may put them toward a zone where there's better arching over, as I was mentioning. I like to use solid core needles. A lot of people don't, and that's fine. This is how I do it. These are just some examples of the recipient side design with a counterclockwise right-sided whirl, clockwise left-sided whirl. And then remember, there's no abrupt transitions in the directions. There should be no abrupt transitions on the angles, which means this way. Why is this important? Because it looks natural, but there are several advantages here. What are they? Number one, if you go high angle in the crown, you have a rounded profile. It creates better lift, okay? You can more densely pack it. Why? Think about this. It's a whirl. They're competing with space. If I'm under the skin, and you're going to hear this the exact opposite with the eyebrow, which is our low angles. So if I'm competing with space as a whirl, okay, and I make them low angles like this, they're all chopping into the same position. But if they're all going up, I can densely pack this with them going up. Does that make sense? They're competing for less space under the skin when they're all arching in a whirl. So these are the 3 reasons I go high angles in the crown, not low angles like in the front of the scalp. And this is just showing a different model of this. Just visually memorize this. And as I said, it is fun. I always put my painting at the end of the design, and then this is after graft placement here. And this is just showing some designs with the graft placement afterwards. Not a big, I'm sorry, this is just the pattern. So positioning of the patient is so important. I saw some of you guys in lab with the patient sitting like you're putting the head between the knees like this and designing the scalp. I hope in your clinic you're not sticking a patient between your knees and designing your recipient sites. Position the patient as you would in reality. Okay, so I don't want to walk in there seeing you have that styrofoam head between your knees. That's a little scary. So you're doing the frontal hairline supine. So put the styrofoam supine. When you're doing the whirl, I like to keep them up, so I have them sitting up. It also allows me to make sure, I always draw the bottom line of that crown, so I make sure that I'm marching down to the end. Sometimes you don't want to be halfway through the crown and go, oh, I'm out of grafts. And then if they're in that whirl going this way, I may turn them left or right to have easier access to those other sites. So I oftentimes, now I'll cover the whole thing with one if I have the grafts, but the front is the most important. The crown is the second, but the crown sometimes needs 2 sessions. So there are many ways to do this. This is not the right way to do it. Now I'm oftentimes doing a total first and then coming back and touching up the crown on a second pass. So clockwise whirl, look at the lateral view. It just adds this beautiful visual lift, that roundness. You can see the baldness from the side view, not just from the back view. This is a correction this is a scalp reduction that the patient had a long time ago, and this is a correction you can see with a single transplant. Even without high density, makes a big difference in the way they look. Weird shapes. You can see a diffusion pattern for a female. Even using finer grafts, you can get good results. Now, this is really cool, is that when they've got just this upper arc, one direction, there's no whirl. I mean, there is a whirl, but I'm at the base of the whirl. I can more densely pack it because they all go the same direction. It's like the frontal scalp. I don't have to deal with the whirl because part of the whirl is already filled with hair. So I love to see this. When I'm only hitting one quadrant of the whirl, I know that I can get better visual density for this patient. And you can see that after one session, it looks pretty good. This is a plug correction. Now, this was small. I could do this with FUE. I did this with FUE. He wanted FUE. This makes sense because you know what's great about plugs? They actually add visual density. You don't need that many grafts to make this look good. And now he looks like a full head of hair without this unsightly appearance. In PRP, for early cases, if they're stabilized in medical therapy, they don't want surgery, this is a good alternative. And it is art. It is fun art. This is a thing I just did 2 weeks ago for my mom. She wanted one rabbit. I said, no, I'm going to give you 19. So I think 19 is 19 times better.